It's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation available for you in English. We're going to go into the briefing room now, where Kim Gang-lip, Vice Health Minister and overall coordinator of the Central Disaster and Safety Countermeasure Headquarters, will be sharing the latest figures and updates on the COVID-19 situation here in the country. And he's just made his way to the podium there, so it looks like the briefing is just about to begin.
We also have sign language translation available. First of all, here is Mr. Kim Gang-lip with the explanation on the COVID-19 response. Let us now begin our regular briefing for July 6th, Monday. As of today, midnight, we have local infections, and we have new local infections of 24 and 24 new imported cases. And as of today, midnight, the total number of confirmed cases now stands at 13,137, and now 1,005 people are in quarantine undergoing treatment. Yesterday, we had one additional fatality, and the accumulated death toll now stands at 284. I extend my deepest condolences to the deceased and the members of the bereaved family. This morning, the KCDC held a meeting presided over by Health Minister Bang Neung-hoo, and we discussed many issues and also the Thanks to Challenge as well. And Health Minister Park also mentioned that there are cases with unidentified sources of infection, despite the fact that the government is exerting full efforts to curb the further spread. And there are also asymptomatic transmissions that are on the rise, and to this he said self-quarantine is very important, and therefore he asked the public to continue participate in quarantine measures. And until starting from June 21st and 4th of July, during the past 2 weeks, we have seen that local infections on an average have hovered around 31.1, and this is slightly higher, slightly lower, about 5.6 lower than the previous 2 weeks. And on average in the metropolitan area has decreased from 33.4 to 19. However, other regions that are non-metropolitan area have increased to the 11.7, and this is some threefold increase from the 2 weeks before. And we witness continuously that cluster infections continue to spread through small group meetings, including those of religious centers, and these are spreading nationwide. In particular, at the Jeolla provinces, we also see that we are seeing increase in the number of confirmed patients, and this is curbing our hindrance to exert our full efforts to curb the virus. And therefore, we believe it is not yet at a stage for us to increase the level of distancing measures. However, we continue to witness a continuous delay in the tracing efforts put forth by the government. And we are repeating our exerting efforts to curb the virus. However, we believe that the situation remains to be grave. The central government as well as the local governments, we continue to exert our full efforts to curb the further spread of the virus and cut the transmissions of local transmissions. And many of the members of the public are exerting their full efforts to comply with these quarantine measures. However, please note that if there are increase of exposure to the social gatherings, there could be increase in the infection. So we ask the members of the public living in these areas to take particular precautions. And here are some implications of our analysis. And looking at the latest infections, many of these places had poor ventilations and poor abiding by the quarantine measures, including wearing of face masks and distancing. And they had greater damages at these facilities. And the government notes that also there were best examples and best practices where there were a successful curb of the virus, and we did a comparison. And for example, there is the Kupang Deokpyeong Logistics Center as well as the Kupang Bucheon Logistics Center. At the Bucheon Logistics Center, which had 152 infections, distancing was not practiced, and they also shared their belongings like clothing as well as shoes. On the other hand, at the Deokpyeong Logistics Center, there were 200 number of contacts. However, there were no additional confirmed cases because they abided well to the quarantine measures. When boarding the shuttle buses, only half of the total capacity were on board, and at company restaurants, separators were set up and people sat in zigzag formation. The same also applies for indoor sports facilities. These are also prone to great infections. And at a health facility sports facility at Uijeongbu City in Gyeonggi-do Province, there were 11 additional confirmed cases. However, as for W Witness in the Bucheon area, they also complied with the quarantine measures, including wearing a face masks. And also among 91 contacts, there were no additional infections. In particular, as for schools, when there were confirmed cases, we completed the monitoring for 18 schools as for July 4th, and there were no additional confirmed cases. And these were all thanks to the quarantine measures, including wearing a face masks and distancing, as well as checking of the body temperature. Likewise, if we abide by the quarantine measures, we continue to see that we can successfully curb further infections even at high-risk facilities. This is why we always ask the public to wear face masks and to avoid closed, crowded, close contact environments. So these are some individual quarantine measures that need to be taken place, and also we need to decrease the risks of infection by having good ventilation and distancing. Up until now, the members of the public have took part in the Thanks to Challenge aimed at helping and cheering up the medical practitioners. And this campaign started from the 16th of April, and today marks the 82nd day of such challenge. And this was initiated first by the Ministry of Health and Welfare, and also this led to the designation of all of the members, voluntary participation of the central government as well as the local governments as well as national celebrities. And more than 40,000 members of the public also took part in this challenge. And also many people have noted that this sign language of saying respect has become a great words of encouragement for those who are exerting full efforts. And we also have witnessed that we are being considerate to others, and we have increased our trust for the society, and we would like to once again extend our thanks to the members of the public. And we also note that this is an important time for the solidarity and unity of the social society, and we want to expand this thanks to challenge to the entire public from the current scope of medical practitioners. Up until now, many medical practitioners and many officials have exerted their full efforts on the front lines, and we believe that this challenge has become a social trend to encourage each other. And making this transition starting from today at the Gwanghwamun Kyobo Bookstore Center and also at the Seoul Station, we will have a building wrapping as well well as media facades, and these will be set up for the next 1 month. And the Transport Ministry has also put in place at the Yeouido Hangang River Park, and they utilize drones to also have a performance art show involving these drones to thank the public. We are, of course, going through very difficult times and challenging times. However, if we continue to encourage the public, we will get stronger. And starting from this, we would like to also note that many of the public have participated in the Thanks to Challenge, and we also want to share a special video to the public. There is a Korean proverb that if you want to go afar, we need to go together, and we have been together so far, and this journey could also be a prolonged one going forward. However, we believe that the central government will walk together with the members of the public. Thank you very much.
That was a live briefing from the South Korean health authorities. We just heard that. We heard that there were 48 new cases of COVID-19, bringing the total accumulated figure to 13,137. There was one additional death, however, bringing the total death toll to 284. That wraps up our coverage of this morning's briefing. Thank you for staying with us, and we'll be back shortly with our regular midday news. Bye for now.